terms of speech generating devices, we're looking at um, technologies that can support an individual who ha- who has a complex communication need and the interactive competence of the communication partners. So even though there may be some sort of technology used, both the listener and the receiver has to be able to understand the communication mode. There are about 4 million people in the US that are not able to use their voice to express their needs and wants. So, alternatives have to be provided for these individuals. And as speech language professionals, that's what we do. Unaided devices require no equipment. So, some of the unaided devices that you may see include the books that you all adapted last semester. Aided AAC devices include equipment. Those include the big buttons that we saw when we were at Pendergrass Fairwall School. They could also include um, iPads as well as other um, equipment in by Donavox, um, and you can take a look at those online for visuals. Communication of the systems is possible. However, there has to be some symbol that is used to classify the AA system. Unaided systems can also include gestures and vocalizations. So, a person's use of their body movement, or if you observe a signal with a communication partner. Observing a signal with a communication partner could be as simple as eye blinks, um, one, one eye blink for yes, two eye blinks for no. That would be a body movement. Raising your hand could be a body movement. So, as we're considering unaided devices, though, we also need to think about a person's physical limitations. Unaided devices also can include manual sign systems. So, you all have seen and signed various signs in language disorders. You can also use iconic signs, which look like the item that they represent. Transparent signs are easily guessable. Opaque signs are a little more difficult to understand and interpret. You can finger spell letters manually from the alphabet, or motor impairment again is going to be quite important as we assess the types of unaided AAC devices an individual will be able to use. You also need to consider the communication partners, and is are the communication partners at home able to understand sign language, and for that matter, in the classroom, are the other students in the classroom able to understand, as well as teachers. Aided AAC include a wide range of representation that are used. It includes input, output, and the degree to which the symbols are transparent or easily understood by others, regardless if they've had training on the device or not. So, some of the types of aided AAC devices include no tech, low tech, mid tech, and high tech. And we'll have a discussion about those areas, and we will also get to see um, low tech, no tech, low tech, and mid tech AAC devices in usage at Pendergrass Fairwell School. Aided symbols are tangible. There are visual schedules can be that are used that are tangible, and they're organized according to the daily activities that occur in an individual's life. Some examples of visual schedules that may be utilized within a classroom are visual schedules for washing your hands. First, you um, would show a picture of first a person pumping the soap, second turning on the water, third washing your hands, fourth drying it off. Think at this time of other activities that would necessitate a visual schedule. And as we're in the classrooms at Pendergrass Fairwall, you're going to consider what activities that the children are going through that could possibly use a visual schedule to aid them in performing the task as independently as possible using visual aids. Aided symbols can include pictorial symbols, um, and they may represent systems, or they may even be line drawings. Um, I will also note that if we are um, using pictures and you're uploading the pictures to a cell phone or an iPad, then you should always make sure, in terms of HIPAA and confidentiality, to delete the pictures, delete the photos after you have uploaded them to the system, whatever system that you're using to print the pictures. Some symbol systems have been specifically designed for use with AAC, and that could include something like BoardMaker, which is typically only used with AAC. And symbolic systems are relatively rule governed and generative, just like in language disorders and language development, when you were talking about generative language and generative communication. So there should be an allowance for symbol combinations and the creation of new symbols. Some other unaided aided symbols, are orthographic symbols, and orthographic symbols include braille if finger spelling is used to spell out different words, writing, or an individual may have their own usage for symbols with language. So there will be individuals who may use a combination of both aided and unaided systems, and people invariably use multiple methods, and mode of communication. So just like any other mode, AAC is no exception to using a variety of types of communication methods. Access is an individual's ability to touch the buttons, point to symbols, or hold an object. So, um, care has to be exercised when choosing the appropriate interface between the client and the device. Um, and when we're discussing care and considering care, um, we are looking at that client's language and speech ability, their developmental level. Is the client still in more so of the oral stage of language? Are they still mouthing devices? And if you are allowing them to hold a device, if it is fuzzy, um, will the saliva from them mouthing the item wet it up? So, you're considering all of that as you're thinking about access to a device. So, direct selection is the person's ability to point with a finger, a hand, a headphone pointer, some sort of optical head pointer, activating a joystick, or using eye gaze. Motor development and um, a person's motor ability must be considered as you're considering which direct selection option to use. You want to consider an individual's efficiency with the speed that they're able to use the AAC device, the effectiveness of that device in meeting their communication goals, indirect selection methods such as scanning, or if a partner assisted selection scanning is used. An example of a partner assisted selection scanning is a board that is clear, that sits upright between the SLP or communication partner and the individual, um, and the 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 individual then scans the board for the various pictures to communicate their needs, wants, desires. The individual who is the communication partner and observer is able to look at the pictures and understand what the individual is trying to communicate. Scanning is the act of assembling a message through a series of switch activations in choices that are presented sequentially. And with scanning, the pictures can be highlighted and may be highlighted for a specific number of seconds, and then the individual has an opportunity um, to push the button, activate the joystick in order to communicate their needs and their wants. In partner assisted scanning, the options are presented by another person. So, with auditory scanning, you use a visual or an auditory cue. Scanning can be slow and laborious for the individual, and it can be very slow because there may be overlays of various screens for the individual to look at. So, as a result, the efficiency of those symbols need to be considered, and the frequency and usage of the scanning methods. Output, voice output um, includes communication that is recorded, it can be digitalized, synthesized, or both. So, voice output that's recorded would actually include perhaps your voice being recorded on a Big Mac or a big button system. Digitized or synthesized voice is the voice that sounds more computerized, that's already pre recorded and inside of the device. Comprehension of synthesized speech um, can require increased attention by the partner because sometimes the words don't sound the way that you or I would pronounce them. And so partners tend to respond more slowly to synthesized speech as opposed to speech that is recorded. So that's just something to consider. Um, but intelligibility can be increased through training and also just exposure and experience with communication, communicating with the individual and hearing the digitized and synthesized speech. In terms of assessment, some of the things that should be considered with assessment is um, it's important to understand the person's cognitive ability. um, when we think about their cognitive ability, you can go back and look at the most recent psychological evaluation that is in the person's IEP or in their folder at a facility. Also, um, that will give you some sort of indication. Does this individual have a mild, moderate, severe, or profound um, cognitive um, disability? And in terms of the communication strength, um, you want to look at that person's ability to communicate. Are they voicing any? If they're voicing, what type of voicing are they using? Is it grunts? Um, is it yelling? If they're not voicing at all and are totally nonverbal, what type of nonverbal communication is that person using? Um, are they um, grabbing for items that they want? Um, physically, is that person able to touch a device with enough pressure for it to um, produce voicing? So consider their motor movements. Is the individual able to scan? Um, what is that person's eye contact like? What is their ability um, like in terms of their ability to understand that XYZ symbol um, means, the vocabulary that goes along with the symbols and the meanings. So you're thinking about all of the different aspects of language that you would if that person were able to speak. So the semantics is extremely important. And eventually, as you train them, you want to consider their syntactic abilities. Are they able to press two or three buttons in a row to indicate um, a sentence? For example, are they able to push I want um, drink to indicate that they're thirsty and they want something to drink, or are they only able to push drink at first? So these are all of the things that you want to consider, um, because they um, add to a person's um, linguistic competence, um, their operational competence, their social competence, and their strategic competence. And I provided examples of all of those as I was speaking. So, some other things that you want to consider include multi contextual observations. And when we think about observing someone in multiple contexts, that could include an individual's usage of a specific device or devices inside of the classroom, in the lunchroom, in the library. If you are uh, a part of a home-based intervention team, like a with BabyNet kids, then their ability to use that device, say in a daycare versus at home. So those observations will give you an idea about how they are communicating, how they may potentially use a device if you're doing trials with them, with specific devices. So observations uh, should be structured where you gaining similar information in all of the settings, um, or they can include standardized assessments if you have that available to you at the specific site with which you will be employed, or at the site that you're have field this semester. Um, you want to use the other individuals around you and participate in interprofessional collaboration with perhaps a OT or PT who can assist with motor assessment. Also, with a PT, you may be thinking, well, OT is fine motor movement. Why should I also um, work with or collaborate with a physical therapist? Well, if the person has um, a limited movement of their legs um, and trunk, then perhaps the PT can do some assessments to determine if perhaps the person needs a different chair. They can also assist with helping to um, create devices to um, serve as a surface for the AAC device. So, there are many ways that you can collaborate with OTPTs um, and even rehabilitation specialists. Visual and auditory acuity and perception are important. Can the person see? What if they do have a visual impairment? Then what degree or extent is the visual impairment? How big should you have the pictures if they have a visual impairment? If auditory acuity is a problem or an issue, um, is the does the person need to be fitted with aids? And if so, making sure that you're working with the audiologist to learn how to um, clean a hearing aid um, and how to take care of it. Making sure it's on, how to change batteries, all of those different things, so that they can get that auditory feedback. The SLP may need to educate caregivers about benefits, and the SLP should collect a list of client preferences and possible symbols to train. So, with collecting the list, that's going to require that you interact with the caregivers, teachers, paraprofessionals, also referred to as teachers aid, because they can give you an idea about what the client prefers. It could be activities, foods that you put on the device, and also specific symbols that they would need to use, say for the classroom or for whatever setting with which that person is in on an ongoing basis. Some AAC system selection or feature matching considerations include, again, um, what is their motor abilities like? Both fine motor and gross motor. What is the individual's cognitive status? What is their lexicon? What words are included in their lexicon? Do they learn new systems easily? And um, are the communication partners as well as the client accepting of a new system that is essentially outside of their body, outside of the usage of their vocal folds? Is the individual flexible? Uh, is intelligibility an issue if the person has some verbalizations? Um, what about the aesthetics of the system in terms of how will the system be um, added to their wheelchair, mounted to their wheelchair? Um, is this system able to be used in a variety of different settings? How are you going to arrange the systems? And what about the size of the systems? And when you're considering the size of the system, that goes back to a person's motor movement and visual acuity. Um, Also, you're thinking about the placement and organization of the symbols, placing symbols that they're going to use more frequently at the beginning of um, the AAC devices, and then maybe symbols that they use less frequently at the end, or if you're doing an overlay system where you use in multiple pages, that the symbols that aren't used as frequently on a second or third page. Um, and also the output of the system in terms of it being voice recorded. And when we're thinking about a voice recorded system, you want the voice recording to reflect the person's sex. So if it's a boy, then even though the majority or all of the students in our program are girls, as you're recording the words, ask another little boy from a general education classroom to record the words. Or you could perhaps ask one of your children who is in therapy for language disorders to name the pictures. And as they're naming the pictures, you're recording their voice in order for the voice to represent the person. Um, if it's a woman, then you would want a woman to record the voice. So, some other things that you can consider with the output of the system is the voice synthesized? And again, with synthesized voices, sometimes uh, uh, the communications partner's ability to understand the voicing can be impaired or challenged at first. So explaining that and getting those communication partners on board for using the system, even if they're not able to quite understand everything entirely at first. Some other things that you want to consider is the method of the communication chosen and how will it flow in terms of a big button system versus an iPad. You want to look at gestures or signing systems. Um, and when we're looking at signing systems, thinking about ease of use with materials in a variety of different locations for which the individual will be housed and where they are on an ongoing basis. Selection of aided symbols um, will always be guided by the individual's cognitive abilities, how easily they're able to learn um, graphic AAC systems as opposed to um, pictorial systems that easily show the representation of an item, and the willingness of the communication partners. So um, education is going to be important with your communication partners and getting everybody on board for usage of the system. And that can even sometimes include parents. AAC vocabulary selection should include needs first. What are the items that that individual need to communicate within their environment? If it's school, words germane to a school, such as books, computer, uh, table, sit in your desk. Desires can include going to specific um, places within the classroom or centers within the classroom, or um, their likes and their preferences for specific foods can be included, or drinks can be included. Everything that you're doing in terms of the vocabulary and the vocabulary selection should be functional for that individual, should be include vocabulary and that they will be able to use and understand based on their cognitive abilities. And if you're teaching signs and symbols, think about the order that the person will need symbols that you're teaching. So, a symbol that you may want to teach in terms of sign language, for instance, may be toileting. That is a need. If the person cognitively is able to tell someone that they want a toilet instead of groping their private parts, you could teach the sign for toilet. And you want to think about all of the person's immediate needs first and then desires and preferences we're training that individual's next. In terms of intervention, this is going to be a moment where interprofessional collaboration is going to be key. It's going to be um, necessary for a team effort to occur. Um, and the use of longer grammatical utterances is slow if users are forming them from a single sentence. So you can pre-store potential utterances that the person uses on a frequent basis. I want, I want, I want food. I want eat. Um, More, please. All of those various items that are multiple utterances can be stored in on one particular picture. Modeling can be used to teach production of multi, multi-symbol messages. So the modeling can occur with both the communication partners as well as yourself as the SLP. And you're going to want to make sure that as you're modeling and training new productions and messages, that you're communicating that to the communication partner, that hey, these are new things, symbols that we're learning, and so that that individual can carry those items over into another setting where functional communication is occurring on an ongoing basis, as opposed to that 1 to 2 hours a week that the client is in therapy. Individual intervention must include short and long range needs of the client. So you're considering what do they need right now, but also long range as they're learning more vocabulary. What will their needs be in the future? So you're constantly considering how to um, adapt the device to the person's um, current communication ability at that time. Um, Some other things to keep in mind are um, creating a positive AAC culture where total communication is accepted, where individuals are willing to listen to synthesized speech as opposed to voice recordings if you're using the synthesized speech, where AAC is a critical part of literacy development, in that vocabulary words from units are uh, carried over into the usage with the AAC device. You also want to use everyday experiences for teaching context. So, everyday experience could be um, if the child is coming up to a door, that if you're saying using open please, that they're able to touch the picture symbol for open please, in order to ask someone to open the door, or if they are eating, um, and you're training more please, that you're using more please. The person has to indicate more please every time they want more food, so that you are using um, you're using um, everyday experiences to communicate, um, and training that usage of the communication. Individualize the content. So everybody's board shouldn't look alike. It should look like what that specific child or individual needs in order to communicate in their natural environment. Um, Again, teaching their communication partner is going to be key. Um, and also teaching them to modify their communication is going to be um, important. So overall, we know that if there is community and parent and caregiver support, then individuals with communication disorders are going to have great outcomes, better outcomes than, say, someone who has no support. So the same applies to AAC. Also, if um, AAC is abandoned, then it's usually related to loss of a communication partner or support from an individual. Um, so, classroom integration requires collaboration between the teachers, SLP, OT, PT, um, librarian. The more individuals that you can get involved with using the device in a functional manner, the better it will be, and the better the outcomes will be for the individual who is using the device. So, if you're getting more people involved, then these individuals have to be trained. So, um, the training aspect is key to successful usage of AAC devices with communication partners. And intervention will be most effective if caregivers use AAC with some sort of speech, and that can include augmented input that's synthesized, or it sounds as though it is a recorded voice. So a child can become dependent on one or two skilled interactions with family members, but it would be even better if you were able to vary the individuals that they are communicating with. You can identify opportunities for communication. You can also create opportunities that the child will need to communicate. And once that occurs, um, create an environment where the child sees a drink handy if they like to drink Kool-Aid or juice or milk, and then that child has to indicate which one they want. So then that is, in essence, creating an opportunity for them to use their device and get maximum usage from it. Um, One strategy that is utilized is the aided language modeling, and that consists of engaging children in interactive play and providing models for AAC symbol usage during play. So if you had blocks, a bucket and a ball, then you would have those symbols in front of the child, and then they have to pick which one they want. So you're in essence using the language to interact and to facilitate play and choices um, within that play therapy session. It is very important um, to use AAC in employment settings. And of course, just like you would work with an individual in a classroom, if you're working with an individual who was, say, transitioning to voc rehab, then you would go on their job and see what vocabulary would be used, see how you can integrate the usage of their AAC device into events and routines, um, and you can even provide them with scripts in order to communicate within the environment. So, optimal use is going to occur when there are ongoing opportunities to utilize the AAC device, and community-based training um, can lead to public members of the public using that AAC device with the individual. The AAC user may be involved in real communication with really meaningful outcomes that provide them with the opportunity to express needs, wants, desires when communicating with others. So, here's some evidence based practice tips with AAC. Um, Conducting clinical research with AAC users is difficult. And one reason why it's difficult is that primarily you may have single subject designs within evidence based practice because you have to consider that if you are going to have a group of students to make up a research group with AAC devices, then they would have to use the same device. They would have to have the same cognitive abilities, same motor functioning. They would have to have the same physical functioning, visual acuity. All of those variables have to be very similar, and the population that uses AAC device can vary very drastically from patient to patient. So many students include only a single subject or a very small number of subjects, and of course, I just told you why. And there is very little long-term research that exists with AAC users. Say, following a child who has a AAC device from using um, unaided communication to, say, aided communication with a Big Mac to um, using a Dynavox or Toby type device um, or iPad, and seeing the changes that occur over time from the time they're like maybe 4 or 5 to 12. You just don't see those longitudinal studies. Another thing that may occur is in context intervention designed to promote generalization and transfer of skills and abilities should be considered so that you are able to target the goals in more than one setting. And scanning as an access method is difficult for young children to be able to scan and follow along and do the tracking that occurs um, with multiple, if there are multiple lines on a communication device. Children that have ASD or intellectual disability, um, it AAC intervention does not impede speech production. A lot of times, the study has shown that it can actually help to facilitate speech production. And for children with ASD, the gains in overall communication form, the use of signs are modest. So, although many individuals who use AAC can understand or comprehend, as well as speak or express a wide range of grammatical structures, um, they tend to produce shorter utterances when they use graphic symbols based upon um, the AAC system. A few studies have investigated the effectiveness of AAC aspect of intervention in a family context to see what's going on. AAC may enhance an individual's speech or may become the primary means of communication. So, if the person isn't communicating at all, then it provides them with a communication support. Diagnosis of the correct type of AAC may need to change as the user's abilities or needs change. So if you're working with a 5-year old and you're working with a low tech device, then perhaps when they're like 7 or 8, you might need to move to a mid tech device and use that in order to facilitate communication. But it's really about deciding where is this person at the very beginning, where are they currently, so that you can make some decisions about IEPs, their goals, their objectives, their um, procedures, rationale, etc. Um, Always concern yourself with linguistic, operational, social, and strategic competence. And that concept was described earlier on in this chapter. So, some good resources that are online include Print Keromic, Dynavox. Those two are high tech and mid tech, have high tech and mid tech devices. Mayor Johnson, USSAAC, um, Closing the Gap in terms of reading, the Center for Literacy and Disability Study, as well as the Center for Technology and Education, um, Rehabilitation Engineering Research, Quality Educators for Assistance Programs, Technical Assistant Project, EdLaw, and AAC intervention.com. So all of these are good sites for which you can go to take a look.